Have you ever wondered about those silent conditions that can affect your health without clear symptoms? Your liver, a vital organ, can sometimes develop issues that are hard to spot early on. A definitive diagnosis for NASH, or non-alcoholic steatohepatitis, usually involves a series of tests, culminating in a liver biopsy. This biopsy is often considered the gold standard for confirming the condition. NASH is a more severe form of non-alcoholic fatty liver disease, where fat accumulation in the liver is accompanied by inflammation and liver cell damage. This inflammation can lead to fibrosis or scarring and eventually progress to cirrhosis, which is serious liver damage or even liver cancer. That is why it is so important to get an accurate diagnosis. While initial blood tests might show elevated liver enzymes and imaging studies like ultrasound or MRI can detect fat in the liver, these tests alone cannot tell us if there is significant inflammation or damage characteristic of NASH. The process typically begins when your doctor notices abnormal liver function tests during a routine checkup, or if you have risk factors such as obesity or type 2 diabetes. They may then refer you to a specialist, like a gastroenterologist or a hepatologist, a doctor specializing in liver diseases. The specialist will often order more advanced imaging or blood tests, such as a fibroscan or MRI elastography, which can help assess liver stiffness and fat content non-invasively. However, to truly understand the extent of inflammation and scarring and to confirm NASH, a liver biopsy is often necessary. This procedure involves taking a small tissue sample from your liver, which is then examined under a microscope by a pathologist. Interestingly, non-invasive tests like the fibroscan and MRI elastography have significantly improved our ability to assess liver health without a biopsy, but they are not always sufficient for a definitive NASH diagnosis. These tools can measure liver stiffness, which correlates with fibrosis, but they may not always distinguish NASH from other forms of fatty liver disease with enough precision to guide treatment decisions. Therefore, the biopsy remains a crucial step for many, providing a clear picture of the liver's condition at a cellular level. Understanding the thorough diagnostic process for NASH empowers you to engage more effectively with your healthcare team. An accurate diagnosis is a critical first step, enabling your doctor to develop a tailored management plan to slow or even halt the progression of liver damage, safeguarding your long-term liver health.